Sherine Beckford, Sherine Beckford. So Sarah, if I understand correctly, you came to the clinic and the attending PSW checked your vitals. So Sarah's vitals are okay. Sarah, also you're complaining about a rash on the neck and on your face. You also have itchy, watery eyes. You feel tired all the time, and you do have a headache. You also have pain in your ears and in your throat. You have nasal congestion, but you do not have any cough. Is that correct?
Yes.
Okay, so Sarah, do you have any aches and pains in your muscles and joints?
Yes.
Okay, has there been a change to your diet?
Just be soft foods but not enough hydrating fluids.
Okay, and you have pain in your ears and throat, correct?
Yes.
Okay, Sarah, have you been outside of your community or the country within 24 hours?
No.
Have you been in contact with anyone with a infectious a virus?
No.
Okay, do you have a history of asthma?
No.
Does your family have a history of asthma?
No.
Do you have any allergies to medication?
No.
Any allergies to food, to any food?
No.
Any allergies to any skincare?
No.
Do you have a fever?
No.
Okay. And Sarah also does not have a cough. Okay.
And just for the record, my name is Sarah Jones. Date of birth January 1st, 2006.
Okay, so thank you for providing your date of birth, Sarah. My name is Sherine and I'm a student nurse. So Sarah, you are comfortable and you are safe, correct?
Yes.
So I'm going to go ahead and provide some privacy for you. So I have to do an assessment for you, and this information will be provided to the doctor. I just want to make sure that everything is okay, and so that this rash is addressed, okay?
Okay.
So Sarah, if you could just stand up for me, please, and walk from here to there. Just make a few steps. They don't have to be big. Okay, thank you. You may have a seat. Okay, so Sarah, are you aware that you're in a clinic?
Yes, I am.
Okay, so Sarah's level of consciousness is okay. She can tell me her full name. She can tell me her date of birth. Also, her gait and her balance seem to be perfect. Her head seems to be aligned with her spine. She doesn't have any deformities. She looks to be approximately 5'6", 135 pounds, which is normal for her height and age. Okay, so Sarah's physical appearance look great. She did wear a winter jacket and winter boots, and it is winter, so that is all normal. Her hygiene looks great as well. Her posture, everything just looks great apart from the symptoms that she's experiencing. And of course, as mentioned before, Sarah's vitals are within the normal range as per the attending PSW. Okay, so Sarah, I'm going to go ahead and do an examination. Is it okay if I touch you?
Yes. Right.
Okay, thank you so much. If you could remove your hat for me, please. Thank you. Thank you. So I'm going to go ahead and I'm going to palpate the head. Okay, so there is no lesions, there is no infestation of any kind. I don't feel any lumps. There's no pain, there's no nodules. The hair texture seems to be consistent with her ethnicity. Sarah is white. And the texture, there's even distribution, there's no alopecia, the hair is not falling out, so that is great. And Sarah, I'm also going to ask you if you could just look at the wall and look at my finger.
Okay.
Okay, so I'm checking for nearsightedness. Sarah, could you look up and down for me, please? Okay, thank you. Could you puff out your cheeks for me? Okay, thank you. Could you make a frown, please? Okay, thank you. And okay, so I'm looking at the face. There's perfect symmetry in the face, and which means that cranial 7 is intact. Okay, so Sarah, I'm going to go ahead now and I'm going to inspect your eyes. Okay. Okay, so I am going to. So I am looking at your eye. So the conjunctiva is pink, the sclera is white, which is normal. That is what we're looking for. So Sarah, please to look at me. Thank you. So I'm looking at both eyes. There is perfect symmetry. The eyelashes have a couple of crustacean because of the itchy, watery eye, but for the most part, she looks great in the eyes. So the pupils are round. The pupils are equal. They are round. They are reactive to light, and there is accommodation. So cranial 3 is intact. I'm gonna go ahead now, Sarah, and I am going to check your ear. Okay. So I'm going to be palpating the ears. I don't feel any lumps, any bumps. The auricle doesn't seem to be inflamed in any way. Sarah's not feeling any pain when I touch it. The ears have perfect symmetry. I'm going to go ahead and I'm going to check for the inner ear. Okay. Okay, so for the external auditory canal, there is a little bit of swollenness, but nothing too concerning. The tympanic membrane also seems to be slightly inflamed, but nothing too concerning. Okay, and for the right ear, it looks perfect. There's nothing wrong there. Okay, so hold on. Oh, okay, so while there's no pain in the auricle, so Sarah has a little bit of pain in the tragus. That may be from the blowing of the nose, but apart from that, nothing concerning. And Sarah, I'm going to go ahead now. I'm just going to inspect your nose, right? So the nares they're slightly inflamed in the left one. From what I can see, let me just check use my tool here. The nasal turbine in the right nose is slightly inflamed, but apart from that, it's perfect symmetry. The septum is perfect aligned. There doesn't seem to be any breathing problems apart from the congestions that Sarah is experiencing. Okay, Sarah, thank you. And Sarah, I'm going to go ahead now and I am going to inspect your mouth and your throat. Okay, so I can see the rash there on the neck area. Okay, so if you could just go ahead and open up your mouth for me, please. Say ah. Okay. So I'm going to go ahead and I'm going to check for the soft and hard palates. I'm also going to check the tonsils. Get my flashlight. Okay, so the tonsil doesn't seem to be past 5 centimeters. It's slightly red, which is expected. The hard and soft palate seem to be intact. Sarah, go like this, please, and make a smile. So the teeth is in perfect condition. There doesn't seem to be any gingivitis on the gum. The gums are pink. There doesn't seem to be any periodontitis. And the lips are slightly cracked and dry, but there's no hydration, and based on the symptoms, these are just normal for Sarah to be experiencing. Okay, Sarah, thank you very much for that examination. So I'm just going to go ahead now, Sarah, and I am going to check your lungs for any crackling sound. Okay, let me just wipe my stethoscope. Okay, before I do this, Sarah, I just want you to do a smell test for me. Close your eyes. Okay, awesome. So we can confirm with the nose as well that cranial 1 is intact, and of course with the facial expression, that's cranial 3, which is intact, and of course with the eyes, our cranial 3 is intact. So Sarah's doing very good with this examination, nothing too concerning. Okay, Sarah, what did you smell?
Rubbing alcohol.
Great. Okay, so let me go ahead and check your chest. Okay, so Sarah, if you could breathe in and out for me. Thank you. Again, breathe in and out. Thank you. So nothing concerning. There is no crackling sound in the lungs, which is good. And this completes our examination. Thank you so much, Sarah. So this information will be passed on to the doctor in regards to your privacy and health. Any information that we share is in accordance with our privacy laws and health laws, okay, for the clinic and for the province. Thank you.